Dear friends, welcome to this series of knee pain seminar DVD. I'd like to welcome you to watch this DVD as we go into the deep depth knowledge of knee treatment, of knee protocols. Okay. I'm very excited to tell you about this program, about this brand new, never really exposed before secrets of healing the knees. And once the knee is healed, it's good. You don't have to do surgery, you don't have to do injection, you don't have to take medication, the knee will heal. This is very exciting, folks. So I want you to stay with me. This is a pretty long video. It's about maybe an hour and a half to 2 hours long. So bear with me, because you are going to learn tons and tons of information about getting rid of your chronic knee pain, right? A lot of patients, when they come to me, they are very skeptical in a way because they have gone to medical doctor and medical doctor told them the only option you have is knee replacement, is surgery. Or they have tried physical therapy, they have tried injection, cortisone shot, epidural shot, they have tried acupuncture therapy, chiropractic therapy, they have tried massage therapy, they have tried to exercise the knee, stretch the knee themselves, they have tried heat pack, cold pack, and herbal paste, salon paste, resting, elevation. Nothing really worked. If it does work, the healing, the comfortable feeling probably lasts only 1 or 2 days. And then the pain came right back right away. And this DVD, I will tell you why the pain come back. I will tell you why whenever you go to the physical therapy or acupuncture, you feel better for 1 or 2 days and then pain come back. I will tell you the secrets of knee pain. Okay? And again, this particular, all the information that I cover is really for information only. It's not for diagnosis. It's not, it's not I'm helping you to treat. No, it's for your information. It's once you get information, you know how to take care of yourself. You know where to go. You know what direction to go for your knee pain. I'm Dr. Lin. I have successfully treated hundreds and hundreds of very tough chronic knee cases, and most of those cases require surgery. Most of those cases where medical doctors do not know what to do, and patient came to me, and I was able to successfully get rid of their knee pain 100%. Okay, let me share with you why I started doing knee pain. I personally have a lot of knee issues when I was in college, when I was 27. I used to be a runner. I run about an hour a day. And at those times, when you were young, you feel like Superman. You have no pain and no aches, and you don't feel tired. But over years and years of running, my knee started to bother me. And eventually, after a few years, I can't run anymore. I cannot run anymore because of the knee pain. And every time when the cold weather comes, or rains, my knee would have pain. And right now I only walk because of the chronic knee issue that I have not taken care of it myself. So that's the reason why I start going into deeper and deeper and digging and searching treatments, protocols, formulas to heal the knee, because I myself suffer from this very knee issue. And I've studied extensively with many teachers, with many professors. I've gone into Chinese medicine. I've studied herbs. I've studied nutrition. I've studied functional neurology. I've studied any kind of metabolic treatment assessment. I've studied how organs relate. Studied how organs, our overall health, how they relate to the healing of the knees. I study all that, and which I will reveal all that secret to you in the video later on. So stay with me. Okay. Now I will discuss with you different cases, 3 different cases on the most common knee pain that I've seen. Every patient, when they come to me, especially those very chronic knee pain, I always required MRI, either a film, actually both film and a report. So let me go over 3 of the most common seen condition in the MRI film, and I'll explain each of them to you. So when you have the film yourself, so when you go to the medical doctor, after seeing my DVD, you're able to actually know what's going on with your knee, and you have more knowledge equipped when you go to a medical doctor, when you go to a physical therapist, okay, and you know exactly where to turn or how to handle your own situation, right? So the very first case, of course, the names are all covered. So let me just go over the case with you. Now, whenever you look at MRI report, you always want to look at the impression. Impression is the conclusion. It's what's going on with the knee. Okay, everything covered the finding. It's the same thing as the conclusion. It's just more wording. That's it. The very first one is called complex tear of the posterior horn of the medial meniscus. Okay, so what is the meniscus? Let's go into the picture. Now, this is the in between the knee. There's the elastic or rubber material called meniscus, and this meniscus serves as a cushion to the knee. Whenever you run, you walk. Now this will protect the bones from grinding on each other. And think about, just imagine this as a rubber band. If you use this over long time, 10, 20 years, don't you think some damage is going to come if you do not take care of it? So that's most of the patient, most of the severe chronic knee patient, they have this meniscal issue where they have tear in either the anterior part of the meniscus or the posterior part of the meniscus. And then again, there's several different tear options. And the MRI will tell you exactly what those tears are. And you can tell right away. Okay? And the healing, it really takes a long time to heal this, because meniscus are torn over time. They don't tear within a few days. Okay, the next issue is a large joint effusion. Let me show you what effusion means. Now, effusion or edema, if you look at one knee is bigger than the other, that means there's a lot of water collection here. And later on slide, I will explain to you why the water is collected here, why the water is not going away. Why? All right, that's called effusion. And third is called moderate Baker cyst. Now, if you look at the knee here, Baker cyst is usually at the very hind side of the knee. Okay, and the lateral view. Now, the regular cyst, this is a water sac. Now, the water sac normally is supposed to be very small. Size of this is supposed to be this size, but abnormal Baker cyst is where the water collects to here. And eventually, the worst condition is that the synovial cyst break and all the water leaks down. Okay, it's going to cause a lot of pain, a lot of discomfort, a lot of tightness of the knee, and the knee swells up like a balloon, like we see in the other pictures. Okay. Next one is non-specific diffuse edema within periarticular tissue. Same thing, edema and diffusion is basically the same thing, basically. Case number 2. Findings, right here, impression. Suggestive high-grade partial tear. Whenever there's a high grade means the intensity of the knee is high, means that there is a high probability of tear. Okay, it says here partial tear of the patellar tendon. Now, whenever there is a high-grade partial tear of the patellar tendon, of any, it could be tendon, it could be ligament, it could be muscles. Okay, but it says it's a patellar tendon. So let me show you what patellar tendon means. Now, the knee here, this is the front view of the knee. This is the tendon right here. So the tear will be right here. The knee will be here. The tendon tear will be right here. This is a pretty common thing in kids that does a lot of sports, football, baseball, that trips a lot, that falls a lot. Okay, soccer is very, very easily seen. All right. Okay. Now tendinosis, and you see tendinosis right here. Severe tendinosis. Tendinosis is another word meaning the tear of the tendon. It's the same thing. All right. Let's go on with the next line, especially at the tendon attachment of the inferior aspect of the patella. All right. Okay. So that means the most common tear of the patella tendon tear, mostly here. A lot of time, kids that are young, the tibial tubercle will have tear here as well too, causing fracture. And I've seen a lot of kids around 14 to 18 years old, they have a lot of tear in the bones right here. Case number 3, impression. Finding a bone contusion in the medial aspect of the weight bearing, okay, with subchondral cyst formation. All right. So bone contusion in subchondral cyst is pretty similar. Let me show you on an MRI what this is. This is a knee MRI. This is the front view, this is the back view. This is toward the foot, this is toward the thigh. And see this white mass right here? This is bone contusion or subchondral cyst. Okay, another one is right here. All right. And if you have this kind of condition, again, you're going to have knee pain. You're going to feel deep aching knee pain. And this knee pain, it doesn't really matter if you're laying down, if you're walking, if you're sitting, there will be deep aching pain. Okay. And the next one, additionally, we see combination of grade 3 and grade 4 meniscal tear. Again, meniscal tear. Grade 3, grade 4 means pretty severe tear in the meniscus. Okay. All right. These are the more common one that I've seen in the MRI. I'm going to show you some other issue. Okay. Another issue that we see very common, especially dealing with senior citizens, is degeneration. Now, normal knee, there will be a healthy gaps here. But this is the lateral side, this is the medial side. If you look at this one, there is no gaps at all. All the knees are close up together. And there's more whitish area, means there's more degeneration because the bones are grinding on each other. And also means that the meniscus is gone, somehow gone, or probably torn so bad that the function is not anymore. There's no more cushioning. So constant grinding of the knee will cause severe degeneration. And if you have knee severe like this, or both of the side have no more spaces, then for sure you'll need some kind of surgery or knee replacement. But if you do not want surgery, if you do not want knee replacement, let me know. There are ways that we can help you to get better without a knee replacement. Another more common, very common thing, knee issue, is the cruciate ligament tear. Now there are 4 different ligaments around the knee: anterior, posterior, lateral, and medial. If you look at the one here, this is the posterior, this is the anterior, or the front. Posterior means the back. There are also the lateral, okay, the lateral collateral ligaments and medial collateral ligaments. Okay, again, these are very common thing. Tear in the ligaments here, tear in the ligaments right here. Okay, very, very commonly seen in young, in old, and for those, especially for those who walk a lot, who carry heavy things a lot, like a nurse, like a cook, like construction workers, post office, postmen. All the time, I've seen tear all the time with this kind of knee pain. And again, if you go to a surgeon, they are going to operate on you. They're going to open up your knee and sew this up. Now, if there is a partial tear, you know you do not need surgery. You only need surgery when there's complete tear. You gotta remember that. Okay, if you have partial tear, come to me, go to some other practitioner, this is easily healed with appropriate treatment. I'm talking about appropriate treatment. Okay. Now there's so many different causes of knee pain, and I will go in detail with you our different possible causes of knee pain. Most of the patient that comes to me, over 90 to 80% of the patient that has knee pain come to me, their very first primary issue of the pain is inflammation. And once I can successfully take away the inflammation, they always feel, most of them feel about 20-30% better. Inflammation, where do they come from? They come from mostly diet, the food you eat. If you Google it, you're going to find out that nightshade vegetables, sweets, sugars, different fruits, different man-made sugar, they will increase inflammation in the body. That's the reason why when patients come to me, the very first thing that they should do is to control their diet. And we have a paper in our clinic showing you exactly what you should or should not eat. And I will personally tell patients what you should or you can or cannot eat. Because if you continue eating the wrong food and continue treatment, it's going to be entirely useless, because while we clear your inflammation, at the same time you eat the food that causes inflammation, there is no way you're going to feel better. That's one of the reasons why patients' pain constantly come back. They feel better for a day, worse tomorrow. After treatment, they feel better again, they're worse tomorrow, because they're always eating the wrong diet. And that's where I come in place. Now, I will tell you, if you become my patient, I will tell you what you should or should not eat, what causes inflammation or what doesn't. And again, different people need different diet. Different people has different, how do you say this? Different people will react to different food. Some, let's say for example, sugar, fruits, let's say apple. Some patient who has very bad health, apple act as an inflammatory because of the fructose. Some patients don't. Okay, another papaya. Some patients, when they eat papaya, the joints swell up right away. The pain come up in the next few hours right away. Some don't. So really, patients have to come in and I test them individually to see what food they can or cannot eat, which food will cause inflammation or not. It all depends on the immune system, on their own health. Okay. The next thing, like we always talk about sugar, and we're going to be watching a video, and this video is taken from YouTube, showing you how sugar affects your blood, and once the blood is affected, how is it affects your overall health. Okay, go and start watching that video right now.
The biggest killers in today's world are heart disease, cancer, and type 2 diabetes. And sugar feeds these diseases like wildfire. I took one of my clients, Ryan, to meet my doctor to show us the effects of sugar on the human body. We were shocked by what we just saw. Hey doctor, how are you?
Good, Ryan. Glad to see you.
Okay, great seeing you. Thanks for having us in.
Hi, Jorge.
And tell me how many pounds you've lost now.
I've lost 47 pounds.
And how much sugar you've been consuming about?
15 grams of sugar or less per day.
Let's do it. So we first drew Ryan's blood in a healthy state, and then we looked at it under a very powerful microscope.
This is what you want healthy blood to look like. All of the cells are individualized. There's no clumping. You're developing energy. The red blood cells are bringing the oxygen. If they're clumped together, they can't bring the oxygen to your tissue beds.
Right.
So that's important. That is about as healthy a picture of blood as I could ever see. Okay, so this is someone who's really cut down on their level of sugar intake.
Yeah, we gotta go to the that's right. All right, you guys ready to go eat? All right. Come on. This is where the kitchen's at. So now it was time to eat. So we started to look at some options. And what Ryan ended up eating was just some simple stuff that most Americans would eat on any typical morning. Things things you would find in your house and things that parents would be happy to give to their kids. Nothing too crazy, really. Just everyday food. It didn't really look like Ryan overloaded on sugar, but in that course of that small 10 minutes, he had almost 200 grams of sugar. That was a nice snack. Let's see what happens to the blood. All right, well, I'm excited to see this, Ryan. What do you think? What's going through your mind right now? Well, how are you feeling? What do you think your blood's feeling? I mean,
Well, let's see. I don't know, I guess it feels a little tingly up here because it's, you know, sugar at levels that I'm not used to doing anymore.
Ryan, after ingesting 200 grams of sugar, within about 15 to 20 minutes, we take a second sample of your blood. And what we see is rouleau, that's a French word meaning stack of coins, where you've lost the ability to have your energy manufactured in the body. You can no longer bring the energy to your cellular beds. You also have something called spicules. These are platelets which have mutated from their normal disc shape to needle-like projections, giving appearances of cracked glass. There are heavy proteins in the blood, and it slows the liver down due to much fat that develops in the blood.
so when we have this stacking up, and I kind of, don't you think I get like caterpillars?
Look at caterpillars, and the sugar actually does convert in the liver to fat.
Yes, right.
That's what's happening.
So it's like gluing it together with
Gluing it
triglycerides.
together. Arrogance or ingesting has tremendous amounts of high fructose corn syrup, along with all of these synthetic chemicals like sucralose, which is Splenda, aspartame. These are toxic chemicals, and their cells are being held together by duct tape. And they don't know it. They don't know it. And when this reveals a very powerful image of what happens to you, this is very powerful.
You think about this, Ryan, when you see this, I mean, what do you see when you look at yourself like caterpillar?
Well, to look at it as before and then now this, I'm just in shock. And before I started cutting out the sugar, I would imagine my blood looked like that constantly.
Okay, this video shows you exactly like after this person eat 200 grams of sugar and the blood started accumulates, clumped up. And when the blood clumps up, think about the healing, right? There's no oxygen, there's no nutrient. Therefore, there's no healing. Your knee pain doesn't get better because your blood is not working. Your knee pain doesn't get better because there's no oxygen, there's no nutrient bringing to your knee. The body does not heal. And at the same time, when the blood clumps up like that, inflammation stays. The knee swollen stays. It doesn't go away. Okay, all these are just, very, very vicious cycle. Okay. The next issue that may have caused knee pain is toxicity. Especially right after a vacation, or coming from other country, or having a holiday like a Christmas, Memorial Day. A lot of patients, they were doing fine, improving, getting better. But right after vacation, most of them, or I would say maybe 70% of them, came back with severe pain with the knee. And I eventually found out that it is coming from their diet, because during the holiday, they're eating, they're drinking things that they're not supposed to be eating and drinking. They're going out to the restaurant. And think about the restaurant. The restaurant food has a lot of what? MSG, chemical, preservatives. And MSG is a big, big player, a big factor in causing severe pain, severe spasm to the tendon, the ligament, and the muscle of the knee. And think about when you have a severe spasm, your knee becomes weaker, and it's more prone for injury, more prone for tears of the tendon, of the ligaments, more tear of the muscles by itself, more tear of the meniscus as well. Okay. So I always tell patients, at the beginning, I always tell them, do not eat those diets. And when they came back having more pain, well, it's not my fault. So when they come back, so I give them some supplement to detox. I use a machine to detox, to take away the inflammation, take away the sugar. And after a few days, the knee is back to the original. The time that they were getting better, the route. Okay. So it's a big factor. So remember, if you want to get better, especially for chronic knee pain, you gotta watch out where you eat. Especially restaurant food, barbecue sauces, fruit juices. There's so many different kind of chemical and heavy metal toxicity. I'm gonna tell you a list of them. For heavy metal toxicity, it's aluminum, antimony. Aluminum could be coming from aluminum foils, the pan that you fry the food with. Arsenic. There's a lot of arsenic in the shelf of the juices. Think about if you apple juice on the shelf, you can put it for 2 years. Why? Because arsenic. Okay. Cadmium, chromium, copper, gold, iron, lead in the copper and in the water piping system. Especially very old buildings and old schools, they have lead, so that's toxin. Manganese, mercury. Mercury is a big one. Mercury is so much. There's so many mercury everywhere in the teeth. Whenever you chew. Whenever something hot goes into your mouth, if you have if you went to a dentist and put a teeth in it, the mercury vapor is going to come up. It's going to start harming your body. Mercury is found in the fishes. Mercury is found in the injection. Mercury is found in canned food. It's like all over the place. Okay, it also found in certain sauces as well too. Okay, nickel, silver, tin, and titanium. These are the list of heavy metals. And the list of chemical acetate, the nail polisher, chlorine, everyday water you drink, the swimming pool that you go into. The chlorine toxicity causes a lot of harm to the muscle and body of the joint as well too. Okay, dry clean fluid, color dyes, food preservatives. That's a big one. Food preservatives, MSG. Whenever you go to a restaurant, whenever you go to, whenever you buy stuff from the market, it's almost always there's preservatives. Okay, and formaldehydes in the sauces a lot. In the heavy chemicals, medication. If you are taking a lot of medication, the side effects of the medication are considered as toxicity. And they may in turn harm your muscle as well. So that's why patients, when they come in, I always ask, are you taking medication? If you are taking more than 1 or 2 medication, there is no way that I can help you, that anybody can help you. Even surgery, you're gonna feel a little better, and it comes right back. So surgery is gonna be useless, because the amount of medication you're taking is considered toxicity in your muscles and your joints. Perfume, fragrance, pesticide, all over the place. Pesticide in your food, your diet, in your vegetable, in your fruits. Okay, plastics. When you put plastic stuff in the microwave, plastic stuff come out. When the bottled water is put under the sun, the plastic goes into the water. So just all over the place. So gotta be careful. We have to be able to detox the body of these harmful toxicity before your knee can actually start feeling better. It's very important. Next cause of the knee pain is the pH imbalance of the knee. Acidity is a major issue in relation to the muscle healing, tendon, ligament, nerve, and the bones issue. Let's go ahead and read this right here. When your pH is out of the normal range, all sorts of bad things happen. For one thing, disease-producing organisms thrive. This explains why some people exposed to certain bacteria or viruses get sick while others don't. Acidic condition can cause muscle to constrict and inhibit the exchange of nutrient and waste products in muscle cells, causing fatigue, soreness, and pain. In fact, the pH imbalance affects all cellular activity in the body, can lead to a wide range of degenerative disease and symptoms. So if the body is very acidic, your knee will not heal. You're going to have more tear. You're going to have more degeneration. The disease, the bacteria, the virus is going to stay and start destroying your knee. Okay? So we have to find a way to solve that pH. First of all, we got to find a way to detect if the body, if the knee, if the muscle, tendon, ligament are acidic or if they're alkaline. If they're acidic, what can we do about it? Okay, that's another secret. And in our clinic, we have all the available tools to find out available treatment protocol to treat if you have aesthetic issue. The next thing we want to talk about is the autoimmune. Like I mentioned in the previous slide, that if the body conditions are acidic, then the bacteria, the virus, the funguses, they thrive. Once the bacteria, virus, fungus, or parasite, once they thrive in the blood, not only do they go around in your body, in your blood system, they also go to your knee. So in between the joint, in the muscle, the bacteria and virus are just going and just thriving and thriving. And if your immune system is not active, if your immune system is not strong enough, the body cannot kill those bacteria and viruses. That's why when you come to the clinic, let me show you a list. This is the list that I check. I will check your white blood cell, red blood cell, basophil, eosinophil, neutrophil, phagocyte, monocyte, mast cell, macrophage, leukocyte, TMB lymphocyte, natural killer cell, cytokinin, catecholamine, histamine, interleukin 1 to 12, interleukin triene, T helper cell 1 and 2. This is a very complete list of all the immune system. There's another immune disease we call autoimmune issue. Autoimmune means that your immune system does not recognize your body parts as its original body parts. They recognize the body parts as a foreign object. Therefore, they start attacking. So your body, if your immune system is not going well, it's not working, it's attacking your bone. It's attacking your muscle, your tendons, your ligament, your nerve. And I've seen a lot of patients, over 50% of the patient that comes to me, over 50% of the patient that goes all over the place, the knee cannot be healed, is because they have autoimmune issue. It's because their body is attacking their own knee, the structure of the knees. So this is very, very important, extremely important. We have to recognize that you have this issue or not. Once we take away this issue, once we clear the sugar, once we clear the acidity, your body is going to heal. The knee is going to start to heal. The pain will not come back. Constantly, it will not come back at all. The next item that caused the knee issue is the missing nutrient that the muscle of the knee, tendons and ligaments, nerve, the bones, they need nutrient. And if you do not give the nutrient that the knee needs, it's not going to heal. Again, think about the food we're eating. Think about if you go to the supermarket, how much percent of the diet of the vegetable, the fruit, are genetically modified? How many percent? Maybe 80%, 70%. Genetically altered food, the nutrient level compared to 50 years ago, compared to natural grown fruits and vegetable, it only has about 10% of the nutrient. So if you eat only 10% of the nutrient from the fruit and vegetable, it's not going to be enough. The muscle will not get the nutrient. The tendons and ligament will not get the nutrient. And therefore, when they're weak, they're easily torn. They easily break. The bone easily break. The muscle tendons are easily broken. Easily. And the meniscus are easily torn. Okay, so one of the main factors is to give the knee the nutrient that it needs. And what kind of nutrient usually? Usually it's minerals. And what else? Amino acids. And what else? Vitamin A to Z. Okay, sometimes could be like zinc, copper, something. Okay, but you gotta make sure you supply the nutrient. And we have ways to test what nutrient you're missing from your body, from your knee, from your muscle, from your tendon and ligaments. Once we found out, we're going to supply you with appropriate nutrition in forms of herbal supplements, homeopathics, or whole food supplements. Okay. The next issue we're going to talk about is stress and emotion. If you look at the graph here, now the issue with the emotion and the organ comes from, this philosophy comes from the Eastern Chinese tradition medicine. If you look at liver, if you are constantly angry, jealous, envy, this negative emotion is going to cause problem with the liver. When you have liver problem, the liver filters out the blood. The blood gets dirty. The body has no healing. If you have a lot of fear, if you're constantly living in fear, fear of your job, fear of your family, fear of money, your kidney and your bladder is going to have issue. Again, kidney is a filter organ. Without proper kidney, you have issue with the knee, you have issue with the back, you have issue with the muscles and tendons. If you are constantly having sadness, depression, grief, crying all the time, it's going to affect your lung and large intestine. And lung produce oxygen, and therefore if there's no oxygen, the knee will not, the healing will not be activated. Okay, if you're always worrying and anxious and you don't trust people, you're going to have problem with the knee, with digestion. A very bad digestion means that the food is not properly digested. The food is not properly absorbed. Therefore, you do not get the healing as well. If you constantly hate somebody, have impatience, you have issue with the heart. Okay, again, heart deal with circulation. All right. So, in regards to treatment, not only do we give you the appropriate treatment, the appropriate food, we gotta make sure you have appropriate healing in dealing with the family, in dealing with your stress, in dealing with the environment, in dealing with your work, with your job, your personal life. And we check that. I personally checked every single patient for their emotional issue. If there is any emotional charges, there are ways, there are techniques that I do to take away these emotional charges, this emotional stress, this negative emotion that cause harm to the body. Okay? And next we have organs. Organ is another major issue that may have caused knee pain. Let me give you an example. I have this particular patient that has gone 15 different doctors for his knee pain. His knee is swollen like a balloon, like I show you in the picture. Edema, effusion. And he's been like that for 2 years. And finally he came to me. And of course, when you have visited to 15 different doctors, you have no faith. Okay, so he came in very, very doubtful, very skeptical. He was telling me, if other doctor cannot help me, how can you help me? So I start pausing, doing Chinese pauses, because I do both Western and Eastern medicine. The pause tells me that his right knee is caused by the kidney issue. So I take care of the kidney, and after a week or two, the right knee swollen is gone. He's very, very happy. He's very surprised. And I start checking his left knee. The left knee is because of the prostate issue. So we take care of the prostate. And after 2 or 3 weeks, the left knee swollen is gone. And the knee pain, basically, it's, let's say, the time he comes in the very first time, it's about 90%. It's like 9 out of 10. And by the time you finish, maybe like a month, the knee pain is like down to 2 or 3 out of 10. So that is amazing. So whenever you have a knee problem that's not able to resolve with any doctor, you gotta check the organs. Organs are very, very important. Very, very important. Okay. Next issue, we have the circulation. Again, we talk about circulation. Circulation brings in oxygen, nutrients, so your knee gets, nutrition, so it can start heal. And also the lymphatic system. If you look at the picture here, now lymphatic system. What is lymphatic? No, most people do not know. Lymphatic system is all over the body. very similar to blood circulation, very similar to blood circulation. If the lymphatic system is not working, you see these lymph nodes here. The lymph node is responsible to exchanging water, fluids. If the fluid are not able to go out of the knee, most of the time it's because the lymphatic system is not working. When the lymphatic system is not working, the edema, they stay in the knee. So not only do we take care of the food, the organs, the diet, the treatment, we also have to take care of the lymphatic system. The lymphatic system is much like a water pipe in the house. Think of the drain and the sink. If the sink does not go down, if the pipe is stuck somewhere, at the top it doesn't go down, the water doesn't go down. There's somewhere stuck in the pipe at the tub. So we gotta clear the piping system. So the piping system is the lymphatic system in the body. We have to clear the lymph system in order for the water to drain, in order for the toxicity to drain out, in order for the inflammation to drain out, in order for the sugar to drain out, in order for all the junk in the muscle to drain out. When all the junks are gone, the healing takes place. The healing starts. Very important. Next item that causes knee issue, inflammation-wise, is the nightshade. I mentioned to you about the nightshade vegetables. I have a list here. I want you to go ahead and read and look at it for me. Let's read this together. Nightshades. An enzyme present in the body called choline esterase originate in the brain where it's responsible for flexibility of the muscle movement. Solanine present in nightshades is a powerful inhibitor of choline esterase. In other words, its presence can interfere with muscle function. The cause of stiffness experienced after consuming nightshade. All people are not sensitive to nightshade in the same degree. Research has proven that when an inflammatory condition exists, consuming nightshade is like adding fuel to the fire. Okay, very self-explanatory. Very self-explanatory. So you just start watching your diet. If you eat certain food, and the next day your knee starts stiffen up, your knee starts swell up, your knees having pain, then you gotta know what food it is. Most likely it's nightshade vegetables. All right. And what are nightshade? Potatoes. Starches. Okay. What else? Peppers. Cayenne, tomatoes, and eggplants, paprika, all these are nightshade. Okay, and I will always tell patients to avoid these. Avoid them as much as possible. Another cause of knee pain is the low back. There's a picture right here. Low back issue will cause refer pain to the knee, also to the entire leg. Why? When the sciatic nerve, it's a big long nerve that comes from the back, usually L4, L5 here. When the sciatic nerve is pressed, the nerve are not being passed down to the knee. The knees are weak. Therefore, knee gets torn, gets damaged. Okay, and this is a dermatome. We look at the dermatome. Now, dermatome L3 goes to here. Dermatome L4 goes to here. If you have compression of the low back L3 or 4, it's going to cause issue with the knee on L4. It's going to cause issue. So whenever a patient comes in with a knee pain, I always check the back. I always check the back to see if the knee is associated with the back or it's not. If it is not, then it's going to be a much easier case. If it is, then we also have to treat the back. In order for the knee to have a complete healing, the low back has to be treated. It has to be. The next issue that may have caused knee pain is the brain. There's a statement from this doctor. He mentioned that less than 20% of the patients that come in for the knee pain, 20% is just the knee only, and 80% are caused by multiple other reasons. That's the reason why when patient comes in, I always have to check all the other stuff to make sure there is no other stuff. If there's no other stuff, the knee is going to be just easy to treat. Okay, Now, another issue, like I said, is the brain issue, neurological issue. Now, think about the knee. What moves the knee? Is it your muscle that moves, or is the brain that moves? Obviously, the brain tells your muscle to lift the knee up, they come up. So if there's something wrong with the knee here, with the brain here, the knee function is going to go down. There is a nerve pathway, we call it LDA, diameter afferent pathway, has a direct connection from the brain to the knee. I'm going to have you watch a video, and this video it's done by another doctor. He also is a knee specialist. He only treats the knee. And he's going to tell you the entire pathway of the brain in connection to the knee, or the knee in connection to the brain, how they're connected. Okay, go and watch that for me.
Is 128 hertz frequency is what we're going to use. I'm going to draw this pathway out. This pathway is called your large diameter afferent pathways. They fire into the brain at about 270 miles per hour. All these large diameter afferent pathways fire in at about 270 miles an hour. So when we're doing these tests, the patient should be able to feel that immediately when you're doing these tests. What we're doing is this large diameter afferent pathways, we're testing the back half of the spinal cord. This back half of the spinal cord here, this back half of the spinal cord is the most heavily myelinated part of our nervous system. It's white matter. Now these large diameter afferents from the lower extremity and upper extremity, this is conscious proprioception. You actually feel this, okay, in health. It's going to fire into our the dorsal root ganglion. Now the amazing thing about this is this large diameter afferent is going to fire off what is called a collateral. Think of a collateral like a tree limb with a branch that sticks out. And this collateral is going to fire into lamina 2 in our nervous system. Why is that important? Because this is where pain fibers fire into, lamina 2. Now these large diameter afferents fire into lamina 2 and they decrease pain. So just think of the simplicity of this. If you can't feel your lower extremities and these large diameter afferents aren't firing properly, you're going to have foot problems, knee problems, back problems. This is how we're going to use the rebuilder therapy to wake these large diameter afferent pathways up in our lower extremity and upper extremity. Remember, these pathways fire into our spinal cord and they inhibit pain at every spinal cord level. These are going to fire up the spinal cord ipsilateral. And I know I'm getting into a little bit of neurology here, but please forgive me. You've got to understand this. You can look this up in any neurology textbook. In the medulla, in the lower extremity, it's going to decussate, it's going to synapse, into what is called the gracial nucleus. That's in the lower extremity. And the upper extremity is the cuneate nucleus. The cuneate nucleus. And this is going to decussate. This is called the internal arcuate fibers. It's going to fire up to the thalamus. And the thalamus, there's a nuclei in there that's called the ventral posterior lateral nucleus of the thalamus, or VPL. Ventral posterior lateral nucleus of the thalamus, VPL. And then this is going to fire into your frontal lobe, in area 3, 1, and 2 in your frontal lobe. So in my lower extremities on this right leg, these large diameter afferents are going to fire into my spinal cord. They're going to stay ipsilateral at my medulla. It's going to decussate. It's going to fire into my left frontal lobe in area 3, 1, and 2. Now in health, when I'm doing these tests, you should be able to feel it. I mean, this fast. I tell patients all the time, imagine, now we live in the South, so imagine a NASCAR that's traveling 270 miles an hour. How long would it take it to go 3 feet? That fast. And that's important because when we start doing some of these tests, these patients are like, I'm not sure what you're doing down there in my hands. That's a problem. Okay? These pathways are demyelinating, and this could be due to stenosis. This could be due to blood sugar, glucose. It could be inflammation and myriad things.
Now you understand that if a patient comes in, if you come in for the knee pain, I will also check your brain, check your nerve, check the pathway, check the neurotransmitter, check check the brain in regards to delta, theta, brain waves. I'll check that as well too. Okay, to make sure there's complete healing to the knee as well. All right. Now, and the 2 more reasons. If you have knee pain, could be cancer in the knee. If it's cancer, we refer them out. We refer you guys out. We don't deal with cancer here. All right. If there's an overweight issue, if you're overweight, if you are 50-pound overweight, 100-pound overweight, of course you're gonna have knee pain. Of course. And we have a program, a weight loss program, will help you. At the same time, we'll heal the knee as well too. All right. We're going to talk about what you should and should not do when you have a knee pain. When you have a lot of knee pain, you cannot run. You cannot. Okay. You cannot work. You cannot carry anything heavy. If I treat you for knee pain, if you have so much damage, if you have a lot of tear in the muscle, in the tendon, in your ligaments, and you continue doing sports, you continue work as a construction, you continue work as a post office, you continue to walk, run, it's not possible. There's no way that I can help you. There's no way that anybody can help you, because healing takes time. Healing takes rest. You gotta rest for the healing to take place. You have to rest. Okay? And again, you gotta control your diet. Control what you eat. Stop all the nightshades. Stop all the inflammatory food. Stop all the MSGs. Okay? Don't stretch. If you go to a physical therapist and you have tons of torn ligament, torn meniscus, and you stretch, it's gonna torn more. The ligament is gonna be more damaged. Don't stress. Don't stretch. Don't exercise. Just rest. Okay? Don't listen to other people. Look at the MRI film report and listen to yourself and listen to me. Okay? What makes it better? Again, rest. Healthy diet. Okay? Healthy diet. And sometimes heat and ice will help some, little bit. Okay? Next, we're going to talk about testing. There are many different ways to test what's going on with the knee pain. Again, the primary thing that I require our patient is the MRI and the X-ray. Okay. Not only do we do the MRI and X-ray of the knee, we also most of the time require a patient to do MRI and X-ray of the back, because most of the time they are related. Most of the time they're related. Okay. There are other blood tests that I require a patient to do. Blood tests such as glucose blood tests, CBC, which is white blood cell, red blood cell. We also want to do blood tests for liver and kidney and the thyroid. Okay, we want to make sure that these organs have, if there's anything wrong with the organs as well. We're going to blood test the autoimmune issue, okay, to make sure that there's no immune system that's attacking your knee. Okay, what a measure, we're going to test your homocysteine, uric acid, to make sure the inflammation in your knee it's high or low. We need to know that as well too. Okay, we need to test for food sensitivity to make sure that you're not allergic to certain diet, certain food. All these can be tested. And we also do a live blood analysis. Okay, and this is the photograph. Remember how we were discussing. Once this particular person eat a lot of sugar, the blood just clumps up. So if you look at the chart here, this is a normal red blood cell. This is the blood that after you have taken in tons of sugars, tons of inflammatory food. Okay? And this is the film we have a lot of uric acid. And uric acid causes inflammation. It causes pain in the gout, in the toe, in the knee as well too. All right? And this blood, if you look at the normal red blood cell, beautiful, round. And this is the red blood cell that has been affected by bacteria, viruses. You see those spikes, mutated. I call it mutated, infested red blood cell. If you have this kind of red blood cell, there's no way you're going to heal. No way. Not possible. Okay, so this is one of the tests that we do here, and just ask for it, request it. Another test we do in our clinic is, or anywhere else you can go, it's a surface electromyogram. So what it does, the doctor in the back, the patient in the front, we have a scanner that scans the entire back. The reason why, again, the back has to be healthy in order to have a healthy knee. The lower back has to be healthy to have a healthy knee. So we check the lower back to see if they're bad or good. Okay? And neurological exam. We do few neurological exams to make sure that your brain are active. We want to make sure if there is any correlation of the knee to the brain. And I'm going to show you a video, a short clip of how we go about doing the neurological exam for you. And this is not done by me, again, this is done by another doctor. But he did it very, very nicely, so I'm going to have him show you.
The fastest pathways that we have. And if I can get you to sit here with your thumbs up just like that for me. Now, what I want you to do is when I do this, does that sensation and that sensation feel the same? Mm-hmm. Okay. Now we're going to give this value a 10. That's a value of a 10. Okay. Now that being a 10, okay, what does this feel like? Okay, so that's a 10. What does that feel like?
Same.
The same as
11 and 12.
11 and 12. Okay. Now we're going to compare the shoulders to the toes. Now this is the 10. And look, put the video down here so they can see. What is that?
10.
10. Come up to the shoulders. Right there. And doing the 2-point discrimination. I'm going to tell the patient. Now, Ms. Smith, if we just have a knee problem, again, it should make sense that we shouldn't have any deficits in the upper extremity. And what we're going to do is we're going to test 3 nerves. One is called the radial nerve. It controls the back side of your arm. The other nerve is the median nerve and ulnar nerve. Those are the 3 nerves we're going to test. And I want you to close your eyes for me. And I want you to tell me how many places on your arms am I touching you? How many places on your arms am I touching you?
2.
Now, in my exam room, my tables, of course, are bigger, so I'm going to take their hands and I'm just going to put it to the side right there. Okay, now, what we're going to do is we're going to test L3 to L4. And I'm going to tell the patient, go ahead and close your eyes for me. And I want you to tell me, I'm going to touch your leg in 1, 2, or 3 places, and tell me how many places am I touching you right here?
2.
In here?
2.
In here?
1.
Okay, and that's normal. Okay, right here, this is L3 up here, this is L4 down here. How many places am I touching you?
2.
This is L3 here and L5 down here. So go ahead and close your eyes for me. And I'll just tell the patient, just tell me again, am I touching you in 1, 2, or 3 places? Right here.
2. 2. 1.
Okay, good. Right here, 1, 2, or 3 places.
2. 2.
So what we'll do is we'll have the patient close their eyes, and I'll say, tell me how many toes between the toes I'm touching right here.
2. 2. 2.
And she missed all of those. Okay? All right? So, all right, let's do this one. How many, with your eyes closed, how many toes between the toes I'm touching?
9.
Your big toe's number 1. Your little toe's number 5. Which toe am I touching right there with your eyes closed?
3.
Okay.